I'm going to start my assessment with the posterior thorax. We've of course already done the patient history and I've washed my hands, and he knows that I'm going to be touching him and tapping on him, and if he feels any pain at any point to let me know. At this point I'm going to be using general palpation and tactile premises. You feel any pain here?
No.
Here?
No.
Here?
No.
Say 99.
99. 99. 99.
Take a deep breath in and out. Okay, next I'm going to percuss the lung fields, and I'm going to be tapping on you a little bit. And then I will be listening with my diaphragm. Take a deep breath in and out. And I'm being sure to listen both inspiration and expiration fully. Take a deep breath in. Again. Again. And for testing purposes, I'm just going to walk my way down on all the points that I would be listening to. Okay. Next, I'm going to be checking for movement of the diaphragm. I'm going to find the scapula and then have the patient take a deep breath in and hold it for me. And then I would percuss each intercostal space until I felt a change, and then have him breathe, and then do the same thing for me. Hold it. Okay, and you can breathe. And when I find that change, I would mark and measure. The next thing I would do would be percuss the kidney, making sure it was hard enough for him to feel it. Did you feel any pain?
No.
Okay, and now you can face me, and we'll be moving to the anterior. At this point, I would be checking the AP to D diameter, making sure that he is twice as wide as he is deep. There's no signs of any barrel chest or abnormalities. So now I will be doing the same thing, pretty much the same thing that I did on the back. Feel any pain here?
No.
Here?
No.
Here?
No.
99.
99.
Again?
99.
Last time.
99.
Take a deep breath in and out. And now I'm going to be tapping on you again a little bit. Good. All right, at this point of the assessment, I would be checking to make sure that his head and skull is symmetrical with his face. If there's any stenosis of the lips or eyes. I don't see any bulging of the eyes. And check your eyelids. Good. Can you open your mouth? I would be checking the tongue, gums, and buccal mucosa to make sure that there's no stenosing of that. I would check his fingertips, making sure that there's no discoloration. His cap refill is less than 2 seconds. There's no clubbing of the fingers. All the skin seems to be uniform, no bruising. Sternum is midline. Now I'm going to move on to the cardiac part of the assessment. I first check the carotid pulses on both sides. Good. Good. And now I'm going to listen. I'm going to have you take a deep breath and hold it for me. Okay. And again. Good. Breathe. And again. Okay. And last time. Okay, good. Okay, next I'm going to be checking the heart tones, and I'm going to start with the second intercostal space and then walking my way down to my 5 key landmarks. You can just breathe normal. you can lay down. The next part, the last part of our assessment will be the patient laying down. All right, I'm going to start by pressing with the side of my hand on the same 5 key landmarks. And then paying special attention to the apical impulse, making sure that I feel it. And I do. Okay, next I'm going to listen with the diaphragm. And then with the bell portion. Have you roll over to your left side. Okay. And that will complete our assessment.